I'm Dr. Aiswarya Yalamanchi, consultant endocrinologist. So today I would be talking about the topic diabetes in elderly patients and management. Diabetes is a chronic health condition where your body is not able to maintain the blood glucose levels in the adequate range, and it can lead to too high levels, leading to hyperglycemia or diabetes. So this condition usually occurs when pancreas in your body is not able to produce sufficient amount of a hormone called insulin, which is in, or it can also result due to insulin resistance, which occurs at various levels in your body, which can be due to obesity, lack of physical exercise, or various other factors. There are many different types of diabetes. Mainly, we do tend to classify them as four major groups, of which they are type 1 diabetes, wherein the person might not be able to produce very little insulin or no insulin at all. The second one is type 2 diabetes. This condition, patients would be having some amount of insulin production and insulin resistance. This condition can be treated with drugs, oral anti-diabetic drugs, as well as insulin. Whereas type 1 diabetes patients usually require only insulin. In that subset of patients, oral anti-diabetic drugs might not be helpful. The other class which we classify is gestational diabetes mellitus. This is a condition which occurs in pregnancy when the mother body is not able to regulate blood glucose levels adequately. This can be a temporary condition which needs to be treated with metformin and insulin as and when required. The other class comes under other causes of diabetes, wherein we group all the rest of the causes resulting in diabetes, which can be due to drugs or due to any problems or conditions associated with the pancreas in the body, due to infections, and several other causes are all grouped together as other causes of diabetes. Recently, we have found that, and many patients are presenting with overlapping symptoms. So we have started grouping patients as clusters in diabetes. Traditionally, we were seeing patients with type 1 diabetes presenting at an younger age group, that is usually between the age group of 4 to 10 years and above till 20 years. But recently, we have found a change in that trend, and we have started also observing patients presenting with this type 1 diabetes in adult age groups as well. Moving on to the other kind of diabetes, that is type 2 diabetes. We usually see them more than 40 years of age group. But due to the tremendous increase in the consumption of fast foods and foods being adulterated with different substances, lack of physical activity, especially during the COVID times, we started to observe that there is an increase in trend or incidence of type 2 diabetes among younger generation or younger population. When we look at the causes of diabetes, type 1 diabetes, as I discussed, is due to very little insulin production by the pancreas or lack of insulin production. So this usually occurs as a genetic defect in the person, and it can be triggered by various infections. But when we look at the type 2 diabetes mellitus, it is more of a lifestyle disorder where persons at risk or usually has a family history, patients who are using some drugs like steroid medications, which can increase the risk of propensity to become a diabetic, and obesity, sudden increase in weight gain. The causes of diabetes are, especially in type 1 diabetes, which is due to production of very little insulin or no insulin at all from the pancreas, usually occurs due to a genetic problem. And this can be triggered by some infections which occurs in the child. Or even recently, we have started observing even in the adult population. When we look at the type 2 diabetes, it's more of a lifestyle disorder, and the more common causes are obesity, physical inactivity, family history of diabetes, usage of some drugs such as steroid medications, which can lead to or cause disruption in the glucose metabolism, Then some genetic defects, drugs, PCOS, and other hormone disturbances all can result in type 2 diabetes mellitus. Even patients who were gestational diabetes mellitus, when they fail to follow lifestyle modification after delivery, they can soon land in type 2 diabetes mellitus in a span of 3 to 5 years after the delivery. The most common symptoms in a person with diabetes mellitus are due to the osmotic symptoms, which I mean by osmotic means due to increase in the levels of glucose in the body. This leads to feeling of increased thirst, increased urination, and increased hunger. Patients also usually complain of feeling dizziness and generalized weakness, especially patients who are having very little insulin or insulin deficient. They come with symptoms of losing weight and tiredness. Apart from this, when we look at the complications associated with diabetes, they come with the complaints of blurring of vision, increased or symptoms of burning micturition, or feeling tingling and numbness in their hands and feet. Diabetes in elderly is usually a little bit complicated when we compare it against other age groups. This is because patients who are elderly usually have other associated medical conditions, wherein we need to consider the medical conditions while treating the diabetes, especially patients who are having renal problems or patients who have other neurological problems can be associated with increased risk of low blood sugar levels, which we also call as hypoglycemia. So we need to be extra cautious in such patients and might maybe not go with a very aggressive approach in treating such patients. The other thing is usually in the elderly population age group, if the patients were already having diabetes for quite long duration of time, can also have complications associated with diabetes, which could be heart problems like heart attacks, stroke, and problems or atherosclerosis in their legs. These problems need to be taken care. And as there is an increased risk of complications, we need to be extra cautious and we need to choose drugs which are having cardiovascular safety, that is, which tend to protect the heart and avoid or help in reducing the risk of complications in elderly population. Moving on to the treatment of diabetes, type 1 diabetes is usually treated with insulin, which can be given multiple times a day. And when moving on to the type 2 diabetes, there are several oral pills and injectables which can be used for type 2 diabetes patients. When we look at the elderly population, we can give pills as well as insulin depending upon the patient's needs. But one thing we need to keep in mind is that the risk of hypoglycemia is much more increased in elderly population. So we need to take care that we are not over treating or over cautiously treating our patients. They need frequent monitoring and frequent adjustments in their diabetes management. One more thing we need to consider is the comorbidities. If the patient is having any problems with their renal function or liver problems, they might need to shift from drugs which might not be safe in such conditions to a safer drugs in conditions of renal and hepatic function, which is also known as the liver problem. And the other thing is patients might forget to take their food after taking the medication. That is one thing we need to take care, and we need to address this issue along with the caretakers to be cautious while giving the injections and to make sure that the patient eats after taking the injection or after taking the medication as advised by their doctor. In elderly age group population, we usually suggest the patients take very good care of their dietary habits. We usually advise diabetic associated dietary lifestyle, and we advise them to take their meals at the proper timings and in relation to their tablets or insulin as well. They also need to carry a hypoglycemic kit along with them wherein if they suspect they're having symptoms associated with low blood sugar, they need to check their blood glucose level with the help of a glucometer. And if the blood sugar levels are less than 70, they need to eat something which can increase their blood glucose levels, such as chocolate or a fruit juice. And we also advise them to take care about their feet, to check their feet regularly, keep them clean, and if there are any issues with their feet, to meet their doctor at the earliest. And they need to wear footwear inside and outside the house as well to protect their feet from any injuries or trauma associated. This is because any injury to the feet can result in problems which can lead to amputations of their feet if the problem is not addressed at the earliest. Moving on to the lifestyle changes, we would suggest them maintain good lifestyle habits, which would be to avoid smoking or abstinence from the alcohol if the person is a smoker or an alcoholic, which can take a toll on his health as well as his diabetes or blood sugar levels. It's also important to look at the comorbid conditions such as maintain his their cholesterol as well as the blood pressure levels in the normal range to avoid the risk of complications such as heart problems and problems associated with stroke or other problems when the patient is a diabetic, as the risk also increases due to the presence of diabetes. Talking about prevention of diabetes, type 1 diabetes is something which is yet in trials looking at the prevention, but at the moment it is not possible to prevent type 1 diabetes. When we are talking about type 2 diabetes, prevention or delay of type 2 diabetes can be done with proven dietary changes, where with especially patients who are in the pre-diabetic range can achieve reversible of their diabetes or remission of their diabetes, which can be done with weight loss, with scientifically proven calorie restricted diets, following a healthy lifestyle, and abstinence from any drugs, alcohol, which is leading to their diabetic condition. Talking about gestational diabetes mellitus, the women who are planning pregnancy need to be cautious and take a nutritious diet even from 6 months before planning or conceiving the pregnancy. They also need to continue following the healthy diet and lifestyles to avoid this condition in their pregnancy. Usually, women who are having PCOS condition are at high risk of developing such condition, and also family history of diabetes, or the women who are having a family history of diabetes also need to be cautious and careful in following their lifestyle to avoid this condition.